Item 1 is presentation by Bushu on the Affordable Care Act.
You don't get a chance to rest?
Actually, I thought it was that other building we met at before, so.
Correct.
When you introduce ourselves, I'm Jeff Boyd.
Jeff, all right.
Ben Jennis.
Nice to meet you. Alan, I met you.
Mike Elsing.
Mike, nice to meet you.
Dan Burke.
Nice to meet you guys.
Cardinal, man.
Yeah.
Travis.
How are you doing?
Good. Augie.
Yeah.
Billy Ann.
Yeah.
Hi, Travis.
I really am.
Sheriff Etmolding.
Reporter Mary Henry.
All right, well, I'm going to pass these around, and I think I should have enough copies here. Let's see, Alan, did you get one?
Do you know, is Carl coming in today?
I haven't heard from him. I do not know.
I tried calling Alan, I didn't get him. You have one extra, I'll set down here in Carl's pile. You have an extra one?
Yeah.
That way,
I got
Billy
one,
Ann or Augie.
one extra.
Yeah.
Billy Ann, you want that?
Thank you.
All right. Well, I'm sure you have all heard about the Affordable Care Act by now, so it's here. And what I've got is we've done a lot of presentations throughout the state on the Affordable Care Act, and I'm just going to kind of hit the highlights and summarize kind of the impact to the county and what the county has to worry about in regards to the Affordable Care Act. So to start with, the most recent delays that have happened here recently are the employer mandate delay, which I'm going to get into that. That basically pushes some of the aspects of this back to January of 16. And the calculation that they're using for that is 100 full-time equivalents. So if the county has less than 100 full-time equivalents, then we would be into the January of 16 time frame. Now, the last time I met with Augie, I think you're around the 80s. Does that sound about right with everybody?
82. Yeah.
Okay.
Yes.
So that is good news. Gives us a little bit of time because there were a couple of items that when I started reviewing this with Augie that we may need to work on in regards to some of the things that are happening. So let me go to explanation of this kind of first, but at the bottom of each page we do have a page number, and then in the lower right hand corner you'll see a slide number. So what I'm going to try to do is refer to the slide numbers rather than the page numbers and kind of avoid some confusion that way. But if you look on slide 2, this is the 2012 timeline, the 2013 timeline. As I said, a lot of these things are already in place or working their way into the system. So the 2012 timeline, there wasn't a lot of items. 2013, you know, you have the W-2 disclosures, which, you know, if you're 250 employees or more, you had to start disclosing on your W-2s. Also, a lot of what I call the backdoor taxes started to come into the act, where they put caps on the flexible spending accounts, the Medicare tax, and those other things. Those all come into effect in 2013. So I'm not going to go through those in great detail, but let's go to page or slide 6. In 2014, the 90-day waiting period did come into effect, and what that means is the employee should not wait more than 90 days for their health insurance coverage. Do you have a question?
No, I just was
Oh, okay.
wanting to know from her how many day waiting period it is now.
We have a 30 days.
That's what I thought.
Yeah, so you're within that. But that is something that did change in 2014. And again, the W-2 reporting is still just for 250 heads or more. So right now the county would be exempt from reporting on the W-2s as well. So but let's flip over to slide 7. 2014, the dental and vision benefits, also the out-of-pocket maximums those are all things that the government has now set basically what the maximum out of pockets can be in network. Now, out of network is a different story there, but in network, these would be the things. Also, clinical trials, those are also in there. Automatic enrollment, that's not something you have to worry about unless you're over 200 heads. If you're 200 heads or more, then you would have to have automatic enrollment.
Going back to slide 7, we offer what, vision and dental separately, correct?
Correct.
Is that something we now have to, is eventually we'll have to put, do we still have to, we can offer it, but we don't subsidize any of it?
Correct, and that's fine for right now. The dental and vision, basically, if you go to the exchange, you're going to have a plan that will include dental and vision benefits. Not a true dental plan, not a true vision plan, but it will include some benefits towards, you know, that avenue.
So by 16, if we have a policy, will it have to include those components?
Well, that's part of the discrimination rules, and I'm going to get to that.
Okay, that's fine.
Yeah. All right, so let's flip over to slide 9, and this really becomes the basis of where I want to start. So the one question that we get asked a lot is, well, what's going to happen? Is it going to go away? My common and standard response is it's not going to go away. Okay, now there may be modifications that are done to the system, but the likelihood that this is going to go away is not very likely. And the reason for that is the old system that we were under no longer exists. You know, there was 20 plus insurance carriers in just the state of Illinois that went out of business. They said, we don't want to worry about, we don't want to comply with it, we don't want to handle the paperwork, we're out of the business. So now we're left with Blue Cross Blue Shield, Health Alliance, Coventry, Humana, you know, basically about 7 to 8 carriers that still write business for health insurance. So the old system is gone. We hope there's some modifications that are done. There's really some things within the act that could be improved. Hopefully they're working on those. But this is kind of the healthcare system as you now understand it. So you have 4 components of that. You have the individual mandate. You have the Medicaid expansion, which I'm going to talk about just briefly. You have the employer mandate, which I just referred to earlier as, you know, some things getting delayed there. And then you also have the exchanges. Now, the one thing on the Medicaid expansion that I want to go back to is a lot of people didn't realize what that was. But what the federal government did is they put a provision in the bill that basically said if any state expands their Medicaid program, then they get funding from the federal government for that expansion. Illinois was one of the very few states that expanded their Medicaid. So when we look at this chart, if you flip over to slide 14, when you look at this chart, it shows you the federal poverty level is $11,170. Okay, so anybody making less than $11,170 is in Medicaid. In Illinois, Illinois increased that income threshold to $15,130. So whenever they did that, that meant more people automatically qualified for Medicaid. Now that won't be an issue, okay, until the funding from the government runs out, which happens in 3 years. So temporarily, you know, we've expanded Medicaid. In 3 years, we have to figure out as a state how we basically fund that on our own, okay, because the government funding cuts out. So let's go back, and slide 10 talks about the individual mandate. And this is, as everybody well knows, the original intent of the act was to get every American citizen health insurance coverage. So what they did is And this is the part that was getting challenged in the court systems, in the Supreme Court. On the individual mandate, it basically says if you're a U.S. citizen and you don't purchase coverage, then you're going to be assessed this tax. Okay, and if you look at it for 2014, it's $95 per year, or it's 1% of your income, whichever is greater. Okay, so you'll see it's a calculated schedule. It's a graduating schedule. If you're 18 years or younger, you know, it's half of the tax. It is a flat dollar amount per person, but capped at 3 times the annual dollar amount. So as far as the collection of that fee, you know, that's really going to happen through taxes or through the IRS. You know, that fee is going to be collected. Now, if you go to slide 11, we're talking about the health insurance exchanges. And grayscale, this doesn't come out as well, but you can kind of see, if you look over at California, Nevada, and Oregon, you know, those states over there, they're a different color than, you know, Texas, Missouri, and Indiana. If you look at the map, those darker states are states that have elected to set up their own exchange and or partner with the U.S. government on a shared, what they call a shared exchange. So you'll see Illinois is a slightly different grayscale color than California. Illinois' exchange is what they call a partner exchange. So Illinois is running their own, but they're partnering with the federal government on certain aspects of the exchange. So the exchange is up and running. It's healthcare.gov. Obviously, you've probably heard about that. Illinois, I believe, is getcoveredillinois.com. You know, and when you leave the Get Covered Illinois site, it is fairly seamless. So you may not even realize that you've switched over to the federal exchange, depending on where you're at in your selections.
You said there's so many insurance companies in Illinois Exchange. You mentioned 6 or 7.
Yeah.
How about United Healthcare?
United Healthcare is one of those. United Healthcare, real quickly, is not real strong in central and southern Illinois.
It is now because the
More-
state made us take retirement.
Correct. More in the northern part of the state, but yes, the state of Illinois just, I think it was the Medicare supplement, just switched that. And I can tell you in Effingham County, UHC is pretty well non-existent, you know, because their contracts are really stringent on the doctors. The doctors just don't want to deal with them when it comes to their contracts. So that's just a brief overview of the exchange notices and, you know, kind of how the exchanges are set. But if you look at slide 13, the state that is operating their own exchange, basically what happens, and this paperwork is underway, that state is going to work much like unemployment. You know, so when you go for unemployment, there's paperwork that has to be filled out. That paperwork comes back to the employer. You know, you've got to figure out, do we protest the claim, do we not protest the claim? So the notices are starting to filter in, they're starting to get out there, but there will be paperwork that will have to be done for the exchange. So, you know, let's just say that you've got a county employee that is looking at the exchange as an option, they're trying to get coverage. You know, that paperwork's going to come back to the county. Somebody's going to have to fill out, you know, what the county offers, how much the county pays. Now, eventually, we're being told that's going to go electronically, much like the unemployment is, but we're not there yet. So we're on the paper side of things right now. Now, slide 14, we really get into the meat and potato of the exchange. And this chart is the chart that determines tax credit eligibility and subsidy eligibility for somebody applying for coverage in the exchange. So let's just take a family of 4. in the exchange, if they are making less than $92,200, they're going to get subsidy assistance. Not going to get a tax credit, but they're going to get a subsidy assistance that helps them pay for some of their out-of-pocket expenses, co-pays, and those kind of things. So individuals that qualify between the 133 and the 400% level, they're going to receive tax credits that help them purchase the coverage.
What would you operationalize 133% of, what is FPL?
Federal poverty level, sorry, yeah.
Okay.
So federal poverty level, which is set by the government, they determine who is going to get a tax credit.
So 23,000 plus 33% is 30,000.
Yeah.
Okay, I got you now.
Yeah.
All right.
Yeah, so you just kind of work your way up, across to the right and figure out where people fall. So now cost sharing subsidies for individuals between 100 to 250% of the federal poverty level. The farther you get to the right in the chart, the less assistance that somebody would get. If you're between 30,000 and 57,000, you're going to get quite a bit of assistance in the exchange. And we looked at one the other day, a family of 4 that was household income was 67,000. The most they were paying was about $100 a month for their coverage.
Who's paying the rest? Or should I ask?
They were in taxes.
Yeah, that's what I thought,
Don't
yeah.
ask.
I know, I'm afraid to.
But that chart is kind of the basis of where things start. Okay, so everything hinges off of this income level or income threshold there. Now let's go over to slide 15. And slide 15 is really where the employer mandate starts. So the employer mandate says that if you have more than 50 employees, 50 FTEs, you must provide insurance. If you choose not to provide insurance, then you pay a penalty. If you provide insurance and that insurance is unaffordable, then you potentially pay another penalty. Okay?
Let me ask you a question.
Yeah.
There's a formula somewhere then there that it makes sense to pay the penalty versus the cost of the insurance plus all the administration.
Well, and we're going to get to that.
Okay.
So probably 5, 6, 7 slides here. We'll get into that, and I'll explain that a little deeper.
Okay.
So, but first off, let's go through slide 15, which is determining the number of full-time employees. Currently, in the law, what the Affordable Care Act says is common law is an employee who works at least 30 hours per week or 130 hours per month. That is what the government has said a full-time employee is. So if you have an employee that's averaging more than 30 hours per week or 130 hours per month, then they're deemed a full-time employee. Therefore, we should be offering them insurance. Okay. When Augie and I had met previously, I know we talked, since the sheriff is here, I know we talked about the part-time people in the police department, where you have a lot of part-time individuals there. And I don't know what other departments, you have where you have a lot of part-time people, but I know Augie had mentioned in the sheriff, I think maybe even particularly the jail area, where you have some individuals that, maybe work 20 to 30 hours. Those are the people. Your variable hour people are the ones that we have to kind of look at this and discuss a little bit. Does that kind of make sense? Okay. So, for non-hourly employees, there's actually 3 things that we can do when we look at a non-hourly employee. Now, keep in mind the Fair Labor Standards Act is the act that dictates how people get paid in the United States, whether it's hourly, whether it's salary. So the Affordable Care Act and the Fair Labor Standards Act, they basically collide when this bill was written. So ideally, you don't want to have a salaried person completing a timesheet. You know, that's against what the Fair Labor Standards Act has always been for, is if you're salary, you don't keep time. You know, if you're hourly, you do keep time. So for a non-hourly employee, you can count their actual hours. You can credit them 8 hours of service for each day they work, or you may use a week's worked equivalency. Now, I would assume for your operations, you probably don't have a lot of salaried people where their hours may be close to a threshold of being below 30. You too? Okay.
They work about half-time if they're salaried.
Okay. So just to give you a good analogy, and I know Alan's very familiar with this, you know, school districts with teachers. You know, teachers have never tracked their time, but when you look at a teacher, okay, they work 7 to 8 hours a day, typically. So you would have to credit them that they're a full-time employee, and you're going to offer them insurance. All right. So for your variable hour salaried people, you have to either track their time. So to try to give you another good comparison within a school, substitute teachers. Okay, today sub-teachers are not tracked. All right, now schools have to start tracking them. They have to track those hours just to see where they're at over the thresholds. So let's jump down into the second bullet on slide 15.
So, excuse me, Trevor.
Yes.
While I'm still thinking of it, back on our people that may be a part of this, on our couple of, they're gonna go back, it says go back on a range between 3 and 12 months. We can't just say that they are working 4 hours a day or 8 hours on 2 days.
Well, I
They have to
guess
start doing timesheets on
yeah,
that.
I guess the bigger
that it?
question for those two individuals that are half-time, are they getting the health benefits?
No.
No. Yeah. Then you would have to track their time.
The actual time, so technically for a while, anyway, they are gonna have to, I mean, they're gonna have to turn in a timesheet.
Yeah.
Do payroll basically now to get paid. Oh, you're talking salary though.
Yeah,
we're
salary.
talking- We're gonna have to track.
They're gonna have to be included in, when they send in stuff, they're gonna have to send in how many hours they worked.
Yes.
Okay?
That's what I was wondering.
That's what I was getting
No,
at.
and that's a good question. If they're not getting the insurance and you're not sure how many hours they're actually working, you know, or they're a variable hour, then you've got to have some way to document that they're less than 30 hours.
Right. And so, yeah, so the part of that is we also need to make sure that they know they're not.
Right, and we will do
Yeah.
that, and then that will go through
Whatever it
billing
comes-
in,
yes,
and then
whenever it goes up to 28, or whatever it is, we need to make sure that that's the end of that week, I guess.
Yeah.
Who are the two you're thinking of? ESDA and
the airport,
airport? Okay, thought, but I didn't want to.
those two.
Well, there'd be 3, wouldn't there? Because there's the two ESTA people are both doing the same.
No, one of them is actually a
And that's
part-time
criminal.
employee, working set hours, and their hours aren't turned in.
Oh,
And then Dave turns in hours every week also. He's a full-timer and does have health insurance,
okay.
okay? There's 3 people out there. Okay, so that covers us at this point.
Okay.
Thank you.
Thank you.
All right. So on the measurement period, there's basically 3 areas that got added. The measurement period, just to kind of summarize what that is, that's what they call the look-back period, where we select a time determination or calendar year determination or a 6-month determination and say, okay, we now need to look back and see all of our variable hour employees, how many hours did they actually work, how many hours did they average, should they be offered health insurance, you know, where are they at in that time frame. Now, that's something we will help you do. You know, we'll help set the measurement period based on when your plan document, you know, when your health insurance plans renew, those kind of things. But the employer mandate delay actually helped you because now you've got a little extra time. Okay, not that we don't need to start very soon, but we do have a little extra time to get our things in order where we want to be at from an hours perspective. You know,
We can go ahead and do that and get the routine set up so we're there and it's just, we're there.
But we're also gonna, obviously, we probably do that with our hourly employees also.
That's what
Yes.
I'm talking
Yeah.
about
Yeah,
both.
both of them.
Yeah.
Yeah,
Both of them, we
so-
need to start.
and I think your plan
Because that's-
renewed September. or-
October.
October,
first.
okay, October 1. So just to kind of give you a glimpse, most of our clients were recommending a 12-month measurement period. So if you take out your plan renewing in October and you say, okay, open enrollment happens in September, we really need our measurement period to be July 1 through August 1st. Because August 1st, you would start your administrative period, which would allow a month to go back through the time records and say, okay, where are we at? How many employees averaged more than 30 that we didn't know about, you know, or we didn't expect to average more than 30? And then you make those numbers, get those recorded, and then, you know, September 1st, you would start open enrollment just like normal.
But we could make a decision that we could, since we're not up against it,
Correct.
we could make a decision that these people shall not work any more than 28 hours from that point forward.
Yeah, you set
But
what
we
their hours
couldn't
are
wait
going
to
to
do
be.
that in 16.
Well, really, it starts in 15.
Okay, well, 15.
Yeah. Yeah, I mean, you really need to kind of get the house in order to,
This
you know,
gives us an opportunity to,
be where you want to be at for variable hour employees. So the stability period then comes in second. The stability period is basically the period of time that an employee would be able to remain on coverage if they became eligible. Okay, so that can't be any shorter than 6 months, but typically that's going to match your measurement period. So if your measurement period is 12 months, what they're saying in their administrative guidelines is we want your stability period to be 12 months. So really the measurement period and the stability period are running along the same line. You know, they're always running together, one's on top of the other. But if a variable hour person becomes eligible, then they get into the stability period, which would be October 1 of 15 through September 30th of 16. You know, and that's kind of where things would start. So that's basically the best summarization that I can give on the stability period. It's the period of time that an employee would be able to be on coverage for the county. Now, if you jump down into slide 16, you get into your administrative period. And as I said, what I was just kind of highlighting for you, August 1st through September 30th would be your administrative period. In an ideal situation, that's a 60-day window that we should be able to get everything done and accounted for on measurement period, stability period, and then who do we have to offer coverage to. Now, you'll see the second bullet here is you may use different measurement periods and stability periods for different classifications of employees. You know, you may use different for salaried employees, you may use different for hourly employees, you may use different for collectively bargained groups. Keep in mind, my general philosophy is to keep things as simple as you can. So for all of our clients, we're recommending to use the same measurement period for all employees. It just makes it a lot easier administratively. That you don't have to worry about, well, when's this group up, when's this group up. You know, everybody's on the same time period. You do it one time per year, and you move forward to the next year. So, all right. Are there any questions on measurement, stability? Did I kind of give everybody a good enough picture on how that would look and run? Okay.
Are you recommending October through December then?
For yours, your measurement period, I would recommend 12 months. And ideally, you know, you would want your administrative period to start August 1st. Yeah. Now, let's get into slide 17. Slide 17 really gets into the safe harbors when it comes to employment. You have variable hour employees and you have seasonal employees. A variable hour employee is based on the facts and the circumstances at the start date of their employment. Basically what they say is employers should use a good faith effort. You know, let's say ESDA, you know, let's say they're hiring another person and that person we know is going to work 35 to 30 hours per week. They say if you know they're going to work more than 30, give them the health insurance coverage like everybody else would get. If they're under 30, let's say in the sheriff's department, they're under 30, the sheriff's not sure whether they're going to work more than 30, then it's based on the facts at the time that they start. So, you know, if they're hired to work less than 30, then all we have to worry about then is tracking their time. If they get more time than the 30 hours in that measurement period, then we may have to go back and offer them health insurance at the end of the measurement period.
So would Ken say, for example, somebody works 3 weeks, 40 hours a week at the sheriff's department, then they're no longer needed, they could bump down to like 10 hours.
Correct.
And then the average would work out over that
Over that 12-month period. Now, that's something as a board, you know, you really have to decide and, you know, get with each of your department heads on. That's probably the biggest struggle that we see with a lot of our clients. We've got a very large retail client, you know, and we get calls from them a lot. You know, they're saying, well, our managers need this person to work. You know, and what we tell them, it may be easier as a department head to manage it by the week, you know, because as things escalate, let's say somebody goes out on leave, you know, and you've got one of your part-timers working additional time and they do it for 4 or 5 months, you know, and that just continues to grow. If you forget about it, then you get to the end and you really don't have much time to make adjustments, you know. So, you know, we look at it and say it's probably easier to manage it on the week. You can certainly do it by the month. There's nothing wrong with that. It just becomes more that the department heads or whoever's doing scheduling has to look at the end of the month and say, okay, well, this person is a part-time employee, but they got 155 hours in the month. You know, now we got to go back and say, well, we want them to average 130, so now we really need to cut down to 125 or down to 120 or down to 115, you know, to get our averages to work out.
Our system, the way it's designed though, it would be fairly easy to scan it and tell exactly where you're at on everybody.
We kind of basically do that with IMRF. We
Right.
have to track
We have to, yeah, so we're doing that, tracking that
Yeah.
anyway, so.
So, you know, the biggest thing that I can stress is, you know, previously when you hired a part-time person, you know, you hired them for a set period of hours and you probably forgot about, you know, where they were at. Going forward, you need to hire them for a set period of hours and that's what they work, you know.
It'll just be real important for the department heads to be aware of all this and to watch what
Yeah.
they're working on.
Yeah. Well, it becomes administration. I mean.
Well, that's what I mean, the department heads to
Yeah.
watch it, because once they worked it, and I get the information, they worked it.
Yeah.
And that's what we run into with IMRF too.
Yeah. All right, seasonal employees. You'll see here a seasonal employee means an employee in a position which the customary annual employment is 6 months or less. Now, when we were talking about this with Augie, he gave us a breakdown of, you know, kind of what everything was. I didn't take that the county had a lot of seasonal employment, and maybe, you know, I'm not aware of it, but
Here,
The highway department.
Highway department.
highway, okay. So
Yeah,
just
other than that, it'd be the highway department.
the road plow,
Yeah.
those, okay.
Yeah.
All right, so, you know, if they're classified as a seasonal employee, okay, there are provisions or safe harbors that, you know, prevent them from getting into that measurement period. You know, so let's say, and now's a good winter, you know, let's say your road crews have averaged, you know, 200 hours a month, you know, if they're hired to work 6 months or less, then they go into the seasonal classification. But again, even if they get into the seasonal classification, you still have to look at their time over that 12-month period. Okay, slide 18 again is more of just the seasonal and the variable hour individuals, how those are looked at. But let's go to slide 19, and that's where we come into play here. As I said, the employer mandate applies to large employers with 50 or more FTEs. You'll see down in slide 20 how they calculate the FTEs. You look at the total number of employees on a full-time basis. Then you look at the total hours worked by all part-time individuals, and you divide that by 120, and you come up with what your FTE calculation is. So if you've got 75 full-time employees and you've got 30 part-time employees, you know, you're taking those part-time employee hours, you're adding them up, you're doing that division to come out with where your FTE calculation is. So I know for sure that you're over the 50, and then it's just a matter of making sure that with all your part-time hours, you're still under 100. You know, that's what we have to worry about next. All right, now they do have transition relief for employers with fewer than 100 full-time equivalents. So you'll see here on the transition relief, limited workforce size, maintain workforce and aggregate hours of service, and then maintenance of previously offered health insurance coverage. You know, the employer doesn't materially reduce the health coverage as offered as of 2/9 of 14. Now, when they passed the first delay on the employer mandate, which kicked it to January 1st of 15.
they didn't pass anything.
Well,
No,
It was,
yeah,
yes.
all right,
So when they moved it, how's that?
there you go.
When they moved it down the road, what they did is they eliminated transition relief. Okay, and I'm trying to get a timeline so you understand this. When they eliminated the transition relief, what the original transition relief said is if my plan renewed before September 23rd of 2010, I had until my next renewal date to be compliant with the Affordable Care Act. So that was the original passage of the act. So if my plan renewed September 1st of 2010, I didn't have to be in compliance until September 1st of 2011. Okay, now your plan renewed after September 23rd, okay? So what they did with transition relief is if you're on a non-calendar year plan, then you had until your next renewal to be compliant. Now, when they moved it down the road, they said, no, you've had enough time. Everybody must be compliant January 1 of 15, no matter what. No more transition relief. You know, you've had 5 years to get there. You should be there by 15. We're not through the most recent 200 pages, but I can tell you that they're putting some of the transition relief back in, but you'll see here, this is at the bottom, that's some of the verbiage. they're saying if you take the transition relief, then you're bound to not reducing hours, you're bound to not changing plans, you know, you're bound to a lot more than what you were before. So I don't have all of the final details. As I said, the 200 pages from the Treasury just came out last week. We're through about 120 of them, going through all the details to figure out what's in and what's out. So, but on the mandate, you'll see on slide 20, the employer will need to offer affordable minimum essential coverage to at least 70% of full-time employees and their dependents to avoid penalties. That goes to 95% in 2016. So by 2016, you would have to offer coverage to 95% of your full-time equivalents. If you don't, then we're getting into what Mike had asked about earlier. We're getting into the penalties. Okay, so let's flip over to slide 21.
Probably, you don't want to stress, but maybe you do, Millian and Jeff, one of it. So do we have to worry about the equivalent then of this 100 full-time by our total number of part-times based on your figures here?
I'm assuming you're going to be close.
That's what I'm wondering.
Yeah, because I can't tell you off the top of my head now how many are.
That's what I,
between
but there's a way,
30 and
you can
35.
understand, what we need to look for here to see if we are.
I
I
think
get that number at 30 to 35.
I think
And
Augie
Payroll's
is-
working on that with.
Okay.
I think Augie had kind of projected you had full-time, you thought in the 70s, maybe even higher than that, right, between all the departments.
Yeah,
I think now it's about 85 that we've got, counting
full-time.
full-time, or the
Full-time.
ones that are eligible for the insurance. That includes the people that have been offered it but opted out.
Right.
Okay.
So I think.
So,
But you have to include that, right?
yeah.
Mhm.
So, you know, if you're at 85, and I don't know, I know you have a high number of part-timers. No. Okay. So we'll just have to see where we come out.
It's gonna be close.
It will be.
You know, especially
But there's
with
a,
the road
but we can
crews.
use this format
Yeah.
based on our past history, because that's gonna make a different impact.
Yes. Yeah, if you're over 100, then you have to be compliant January 1 of 15.
That's what I thought.
That's the only difference.
Yes.
We have some people that do not want our insurance for various reasons, or are retired and are taking Medicare.
Mhm.
Do they count against us on the 95%?
Yeah.
What happens if you
Well-
have a bunch of older folks that,
I'll
that-
quit.
well,
Well, what happens is you have to offer
It says
it.
offer.
oh, no,
So,
offer.
if they're over 30 hours per week and they're a full-time employee, you have to offer it.
Right, and we get a signed thing
And
saying
they sign a
denied,
declination,
then we're okay.
yeah.
Okay, all right, you
But
made it sound like.
Your question is very valid because we have this right now with a lot of retail service industries where people are coming in and saying, I really want to work more than 30 hours and I don't want your insurance, just let me sign off. That waiver is not any good. You know, it may be good when they sign it, but in a year, if their spouse loses their coverage and they need it, you can't prohibit them from coming on.
No,
And we still have the academy. even though
Yeah.
they left. Yeah.
right, I understand that.
So it's gonna, the main thing is gonna be how many in that 30 to 35 range that we've never had to offer insurance before do we have? That
I
are
don't
gonna
know.
kick it up, I mean, that's, yeah, that's. what we're
Yeah,
gonna-
yeah, and I remember we
keep it.
talked about that the last time, that you've
Payroll's
got
gonna
a
be
group of
straightforward.
employees between 30 to 35 that have never been offered insurance, so.
Yeah.
So let's go into the employer mandate, slide 21, and this is the no coverage penalty. So to answer the question earlier, this is the slide. Basically, if you said, well, we're not going to offer insurance, we're just going to pay the penalty, it's $2,000 times the number of full-time employees minus the first 30. So you take your total number of FTEs minus your first 30, and that basically becomes your penalty for not offering coverage.
Well, can we
104,
104.
104,000.
offer them $500 a month? That's bad, let's say $200 a month.
Well, whatever amount.
Yeah, whatever amount, and say you go buy any insurance you want with it.
Let's come back to that if you don't mind. That's kind of a different discussion area.
Okay.
So let's come back to that. So if you look at the example, we're showing you the employer employs 55 full-time equivalents, 45 of which are full-time. The employer chooses not to offer health insurance. You're seeing the 45 minus the 30. You're getting your numbers. Now, the thing to keep in mind with the penalty is when they originally passed the act in 2010, they were using premium data from 2008. So their premium data was old when they passed it. They have already formally announced they undershot the penalties. You know, their original goal was not to make the penalty cheaper than buying the insurance. So what their goal is eventually is they want to get the cost of the penalty to the average nationwide cost of single health insurance coverage. And that right now, if you go to Kaiser Family Foundation, is around $5,800.
Now you're talking about through Obamacare, or you're talking about through any?
The penalty eventually is going to be based on the nationwide cost of a single coverage. So right now, as I said, that's $5,800. That is eventually where they want to get these penalties to.
I know this is probably, you're gonna answer this. We currently, just for round figures, our coverage is $500 a month. We subsidize, say hypothetically, $100 of it. I mean, we pay $400, we ask the employee to pay $100. That's not the actual case. Are we gonna be able to do that?
Well, and that's the second one here.
All right.
So let's go right to that one. So the second penalty is one of two penalties. Okay, we talked about penalty number one, which was the no coverage penalty. The second penalty is if I'm offering coverage and it's inadequate in two different areas, then we have another problem. So we're offering coverage, we're making it available to all those that are eligible, but our plan is not very good or it's unaffordable. So let's start with the right side of our box on slide 22. Minimum value, okay. What the government said is if your plan does not pay 60% of the actuarial value cost, then it's not going to be deemed a minimum value plan. Now, Blue Cross, Health Alliance, Humana, UHC, we've talked to all of them. I am not aware of any carrier that plans to sell a plan that doesn't meet minimum value. You know, the guy from Blue Cross, we talked to him a couple of weeks ago, he said there's no reason for them to sell a plan that doesn't meet minimum value. Now let's move back to the left, and this gets into the affordable section. One of the big fallacies that is out there is, you know, the government mandated what the employer should pay. Okay, well the government didn't mandate what the employer should pay. What they did mandate is what an employee should not pay. Okay, so an employee should not pay more than 9.5% of their household income towards single health insurance coverage. So it's based off of the single, and it's based off of the lowest value plan that you offer. So you'll see right below that, household income when it first came out was very, like, well, we don't know what the spouse makes if we only employ one person. The act said household income, so then they came back and clarified it and said, well, we have a W-2 safe harbor. The W-2 safe harbor says if you don't have duly employed spouses, you look at W-2 income for just your employee. And that's what you base it on.
Okay.
If you have duly employed spouses, both spouses are employed in the county, then you do have to look at household income. It would be both the W-2s combined. Now, as I said, it's based off of the lowest plan that meets minimum value. So let's say that you've got Plan A, which is a really rich plan of benefits, a $250 deductible. That premium is $650 a month, okay? You don't have to base it on that if you offer Plan B and that premium cost is $400. So that 9.5% would then be calculated off of their income and figuring out where we're at from that standpoint. Now, what we'll actually be doing for the county is what we call an impact analysis. And basically we take thresholds of the lowest paid individuals in each of the departments and say, okay, do we have any issues in the road and highway department? You know, or do we have any issues in the law enforcement department? Or do we have any issues in the administrative department? Just kind of identifying where, you know, we may have potential issues from a funding standpoint. Now, obviously, if you're paying 100% of the single premium, the affordability is really out the window. But if you're at a dollar amount and it's capped, then we do have to figure up and say, okay, well, how much is the employee paying out of their pocket? Is anybody close to the 9.5% number? If they are, then what's our plan of action to address that?
We have 3 plans now. Are all 3 plans acceptable? 4? Are all of them acceptable under
Yeah.
Affordable Care Act?
I believe you have an HSA plan.
Yeah, they all meet the standards.
Yeah, they all, that would be your lowest one.
Okay.
They would all meet the standards.
And I think we fly well under the 9.5% that I'm aware of based on W-2s. You figure you don't have any W-2s for full-time less than 20 grand.
I don't do the W-2s.
Well,
so I don't know,
I don't think we do. I don't think
Less
we've
than
got
20
about
grand?
20 grand, I don't think we've got too many making this.
Full-time?
Full-time. Really?
I mean, I don't know them all.
Well, we're all considered full-time, aren't we? And we all make less than 20 grand.
It shouldn't be you.
I don't know. I don't see the W-2s.
Okay. At any rate, even at that, it's $160.
Yeah. Or
So-
if we take the lowest one, and it's HSA 2, where the employee doesn't have to pay anything,
Correct.
everybody could take that if they truly wanted to,
Yeah.
and it still meets, according
The
to
affordability
Blue Cross
standard.
Blue,
Right.
it still meets this, right?
Yes.
So I mean,
Yeah.
So there's no issue.
No,
well, it
shouldn't.
shouldn't be. It's
Shouldn't-
probably has to look
shouldn't
at this
be.
more definitely, but I'm
It
just
shouldn't be
looking
an
at
issue with
at
based
just
on that.
HSA 2.
Travis, if we offer one and somebody that would fall in that 9%, they have an option to take a lower one, but they choose it. So
Then there's no
there's
penalty
no
if they
penalty
go
then, right?
higher.
Because they've chosen
Yeah.
that.
Right.
Yeah, if they go higher, then there's no penalty.
That's what I'm trying to check there.
So yeah, if your flat dollar contribution amount is covering, 100% of that HSA plan, then you really shouldn't have any issues with that.
And that is in addition to the 3.25% that they kicked on for everybody? Like whenever they
The
kick that,
fee, yeah,
the fees have to go in there and we have to pay for the fees also to be 0.
yeah.
Kind of.
Well,
Making
yeah.
sense there?
Yeah, and the fees, there's a lot of debate right now about the fees. The reason they did the fees the way they did is the insurance carriers got a medical loss ratio put on them, and basically what that did is that regulated the profit they could make. So the government said you shouldn't be making any more than 20% profit. So the reason that we had all these increases in premium is the carriers got the rates where they needed them to be profitable. So when the government looks at it and they say, well, okay, your premium's $500, the carriers don't have to count the taxes and the fees as part of their premium calculation on whether they made money or not.
So they're part of the problem too.
So they, you know, they set those aside and said, okay, all we have to worry about is the 500, not the $516. You know, we're just calculating based off
We're
the
not
500.
even, they're not even doing anything for us in this regard yet, but we're paying them an extra year in fees.
No, the fees are already intact.
I understand that. but-
Yeah.
But my question as a taxpayer and somebody paying the bill.
Well,
is
the
that
medical.
They're not doing anything for it.
Well, the medical loss ratio is in effect. So if your loss ratio falls below 80%, then you should get a rebated amount from the carrier. If you're above 80%, then there's no rebate.
Okay,
So that is in effect.
okay, so
Yeah.
we could get some money back if we have some.
If your loss ratios are under 80%, yeah.
So I'm just trying
No,
to figure out though, if we pay for our lowest acceptable minimal value that's covering all this stuff, which I'm assuming, like you said, Blue Cross is saying, and I know this is coming up in the future, but I mean, if all things being the same, then
Right
we're
now.
probably gonna be all right. even
You
right
should,
now.
yeah, should be all right. Now, let's go to slide 23. Slide 23 is the tail end of the affordability and the minimum value. So slide 23 is if the employer fails to provide health insurance coverage that is affordable and provides minimum value, it is the lesser of the two penalties. So you're looking at it and you're saying, well, what does that mean? Okay, $2,000 times the number of full-time people, that's a pretty expensive penalty depending on where you're at. But let's say that we have an employee that averaged 32 hours and we failed to offer them coverage, okay? Then we have to look and say, well, are we below the 5% threshold? Let's hypothetically just say that we are, okay? Then our penalty becomes $3,000 for the number of full-time employees that go to the exchange and they qualify for a tax credit or subsidy. So if they go to the exchange and they don't qualify, there's no penalty coming back to the county. If they go into the exchange and they qualify and we should have been offering them coverage, then we're going to get a $3,000 penalty for every person that does that. Not on all full-time employees, just every person that does that. Does that kind of make sense? Clear.
Will the exchange then be cheaper than what we're offering the employee, or can it be?
It can be, depending on, you know, if they're subsidy eligible and tax credit eligible. But if you're offering them coverage here and it's affordable, then they're not going to get a tax credit or a subsidy in the exchange.
So it'd be stupid to go to the exchange then.
Yes.
So we're subsidizing Uncle Sam.
Yeah, yeah, right. True.
That's the whole idea.
Yeah, well, otherwise they couldn't afford the insurance.
So let's go to slide 24. On the employer mandate, the exchange determines whether the individual is eligible for the tax credit or subsidy. That's not the employer's job. The exchange does that. The exchange will notify the employer of full-time employees who qualify for a subsidy or credit. If the employee has adequate health coverage from the employer, as I said, they will not qualify for that. And if an employer is assessed a penalty, and that penalty is not correct or right, then there will be an opportunity to protest that penalty. And as I said, that's going to work much like the unemployment process. You know, there'll be paperwork and protest that has to be filed for that to happen. All right, slide 25. This talks about all of the taxes and the fees that were put on. The main ones are what I call PCORI, which is Patient-Centered Outcome Research Institute. That's a new fee. They're setting up an institute that studies the outcomes in clinical trials. Everybody is funding that in the United States through their premiums. So this year it was 14 was $1. That goes up to $2. That is scheduled to sunset before 2019, but I'm not sure that that will ever sunset. Okay, when you start an institute and you try to figure out how to fund it, you know, I'm not sure how that sunsets, but that's there. The annual health insurance industry fee, that slide you'll see is on slide 28. Okay, the purpose of that is the health insurance issuers will be assessed an annual fee to fund some of the provisions of the Affordable Care Act. For instance, the fee will help fund premium subsidies, cost sharing reductions for those who purchase health insurance on the exchange. You'll see there for 2014, they estimate to collect about $8 billion, 14.3 billion by the time 2018 comes. Now, who pays the fee? The health insurance issuers are responsible for paying the fee. That fee obviously comes back to the insurers, okay, in the form of premiums.
We know, yeah, we know.
You couldn't take like a few bucks out of their $20–30 million salaries and their company jets and all that to fund some of that.
They chose not.
I'll bet not a single dollar.
So TRP, which is the Transitional Reinsurance Program, one of the things that the Affordable Care Act did, it established a transitional reinsurance program to basically help stabilize the premiums for coverage in the individual market during the calendar years 2014 to 2016. And I don't know how familiar you are with this, but the individual market as it existed prior to 2014 is non-existent. You know, it used to be if you wanted to shop for coverage, you would go to a local agent. You know, they would set you up with an individual policy. Now, you know, you can go to a local agent. They may or may not be able to help you with the exchange, depending on if they got certified or not, okay? Or you can just go to healthcare.gov and you shop for an individual policy there. So what they did is they purchased reinsurance to help stabilize those goals that they had. But obviously, reinsurance is always for high risk. So, you know, part of the exchange is high risk patients also got access to affordable coverage. And they set up a high risk pool to make it more affordable for people that had conditions to get health insurance. So again, that's there. You'll see here that fee, HHS proposed that the annual assessment will be $63 per covered life enrolled under a plan or policy in 2014. That is one of the fees that you got taxed with, you know, January 1st. That was part of that 3.25% increase. The risk adjustment program and fee, as I said, that again is to help the insurance carriers kind of levelize and reduce their excessive premium growth and instability. That one's coming yet. Then if you go over to the health insurance marketplace, that's the user fees. So the ACA required that health insurance marketplaces to be financially self-sustaining by 2015. So if, you know, as people get on the website, and you'll know there was a big debacle, you know, about the website not working, basically that fee is to help fund that. Okay, so you'll see here, HHS proposed a monthly user fee equal to 3.5% of the monthly premium for each policy in federally facilitated marketplace. Marketplaces will take effect in 2014 benefit year and will likely be a permanent feature of the marketplace. So the way that they're funding the marketplace is they're charging a fee in basically the marketplace for the users of the market. Now slide 32 hopefully never becomes an issue, but one of the things that they passed was the Cadillac excise tax. Basically, it's a tax for high-cost plans. The Affordable Care Act requires health insurance issuers and self-funded plans to pay a 40% tax on annual premiums that exceed defined thresholds of single and family. That tax will generate revenue to help finance more reform. But by 2018, the thresholds are $10,200 for a single, $27,500 for a family. If the plan would go over that, then you would be responsible for paying that 40% excise tax. Now, there's really great debate. There's not a lot of rules out on this yet because it's not here, but there's great debate, you know, in the fact that if you offer multiple plans and just one of those plans go over, you know, does that still kick you into the tax? And that's still up in the air right now. So let's go to slide 33. Slide 33, we get into our non-discrimination summary. And one of the things that they passed as part of the law is discrimination rules. Those were supposed to go into effect in 2012. They put a delay on those. They just officially delayed those again about a month ago until further notice. Further guidance. But just a brief summary of what those are is fully insured plans may not discriminate in favor of highly compensated individuals. Self-funded plans have to follow those rules now already, so those are there. But the penalty for this is $100 per day per discriminated individual. Now, one of the things that really challenged this rule was individuals that had contracts that were negotiated. And I don't know if you have any of those or not, but if you have a negotiated contract with an individual, they're highly compensated, and they're getting a greater benefit than the bottom 75% of the organization, then that's where this would come in. Now, the original intent was the government wanted to do away with what I call the golden plans, where the CEOs have a $0 deductible plan and the low-level employee has a $2,000 deductible. That was their intent. What they didn't realize is how many collective bargaining agreements this was going to affect, how many individual contracts it was going to affect when those are all bargained for separately. So it's been a real challenge, and that's part of the reason that it got delayed. Was there just wasn't a good way for them to fix it and address kind of what they wanted to address. Now, these rules exist now. So in 401ks, if you're familiar with the 401k, you know, they have to do discrimination testing for highly compensated people. You know, the top of the organization couldn't get a greater benefit than the bottom 75% of the organization. So that's what they were going at. They weren't aware when it passed how many collective bargaining agreements were out there and individualized contracts that this affected. So, slide 34, I'm not going to try to explain to you, but you can see it's a mess, okay? It's our best explanation of how it actually works, okay? But, you know, as you see, start here, you know, you basically follow our words. If the family income is at below 133%, then you're kicked up above to the individual has Medicaid options, okay? If no, then is the employer coverage available? So what we're trying to show you basically here is the steps that the exchange is going through to qualify an individual. And then also, if they come in and they are available under a group, you know, these are the steps that are going to be went through. So, all right, I'll open it up for questions. Now that I've got heads swimming and everything else going through your minds.
I've got a question, Travis. We're talking about contract employees for the highly compensated. But going back to the 30, 35 hours, if they do a contract where they don't take insurance at all, does that alleviate us from having to count them?
No, if they're over
We still have to
30
do it.
hours, yeah, and we actually deal with some collectively bargaining groups now that had 35 hours in their contract, you know, and we went to them and said, here's the deal, you got to change it. You know, everything we're reading doesn't allow for you to bargain the law. You know, the law says 30 hours.
So in a contract, if the person says, I'll work and I don't want insurance, that's, doesn't matter.
Yeah, yeah. If they're over the 30, you've got to offer it.
Travis, is there any advantage to us, to you, if we moved our health plan to the calendar year?
Well, the advantage would be that your deductibles would then match up with
Right.
your calendar year, which is fairly standard.
Right.
From a budgeting standpoint, we would have to look at, you know, when the county actually passes their budget, and I'm not sure of that date. Okay, so from a budgeting standpoint, it's probably better for you to know in November what your rates are. You know, so does that outweigh having the deductibles match up for the employees on a calendar year? Financially, you know, it's just how you want to handle it.
You're not intending on changing that.
I've tended on being one opinion of 7.
Okay.
Okay, and then we'll make the decision.
Well, we had
together.
discussed it.
We have discussed it, but I don't think there's been a recommendation. We have been explained to by employees the hardship that it avails itself to in certain situations because of health problems that they have towards the end of the year, and then boom, they're
And they can't get scheduled,
right.
so they're over on the next.
Right,
deduct-
or it's in the middle of it and it still messes it up.
Yeah.
So I think we need to take both things into consideration.
What, the discussion we had today, there's very little, we have very little leeway. I mean, you're just basically giving us the bad news. There's not a whole lot of decisions that we have to make.
Well, yeah, yes and no. You know, and you had asked a question earlier about the penalty versus the coverage. Obviously, you've got collective bargaining agreements that you have to deal with. You know, it's not going to be easy to get health insurance out of a CBA that already has it in there. Then you have the aspect of, you know, being an employee of the county, you know, what is the benefit? You know, so those are questions that as an employer you have to go through and say, okay, well, you know, what makes it attractive to work for the county, to get quality individuals coming in. The one big thing with the penalty that I tell all of our clients is, it may be cheaper today at that $2,000 level, but when it gets to where it is going to end up, you know, you're probably going to be at the same cost that you may be. So that's just one of the factors you have to
Well,
consider.
who's actually gonna end up going to jail if we don't pay? I mean, they take, well, no, they will.
We draw straws.
Yeah, I guess, I mean,
There are things that we
Have
can
one
do.
leeway.
yeah, I mean, if we
As
just.
we go along and discover, for example, if we've got some employees, basically that are part-time that are close to 30 hours or a little over 30 hours, we may have to make some adjustments there. When people retire, we may have to look at how we handle that per department. There are things that can be done.
Mm-hmm. Yeah. I mean, I think the big things that you have to worry about now are your window of people that are between 30 and 35. As I think 35 is what you use now.
Yes.
That, you know, the county really has never accounted for. And, you know, what are you going to do with that window? You know, is everybody within that window getting health insurance at the, you know, at the same levels? Are we going to manage the hours differently? You know, getting with the department heads and saying, okay, where do we need to be at staffing levels to have appropriate coverage? You know, those kind of things. You know, I think those are all questions that have to go back to the department.
But I think the government in a large part is expecting everybody just to go along with this. And when people say, I'm not writing that check, and the county says, hey, collect it, sue us, whatever. What I'm saying is, I expect to see a revolt across this country. People aren't gonna do it. How are you gonna get people who have $10,000 a year income to, they're just not gonna do it?
Yeah, that I can't answer.
And how are they gonna collect from them? I mean, they don't have jobs, they don't have homes, they don't have anything, what are they gonna
They're the
do?
ones that get the subsidies.
Yeah, but
Yeah, less
They're
of a
getting
less of a
theirs.
refund.
Yeah,
Yeah,
they get theirs.
they get
It's us
theirs.
working
Oh, yeah,
people that have
They're
to worry.
getting theirs.
All right. Never believe it.
Travis, what question should we be asking you?
Well, I think, you know, some of the good ones you've already asked. Now it's just a matter of narrowing down, you know, I think with Augie and Billy Ann, you know, where we've got areas of concern, you know, in that 30 to 35 hour window, and then, you know, getting with the department heads and saying, okay, department heads, how many part-time people do we really have? You know, where are their hours at? You know, and from an operations standpoint, you know, what do you have to have?
And identify seasonal.
Yeah, identify,
Especially
yeah.
here, and make sure that everybody understands from an administrative standpoint here what that means.
Well, even in our other departments, if
Well,
we're
yeah.
trying to say like, we need to make sure if we're hiring different people, I mean, everybody in the department can do whatever they want to, but here's the amount of money that we're allocating. We're allocating 28 hours,
Yep.
you know, or whatever it is, because,
And then we need to give them an administrative aid so that they can track that, which we should be able to fairly easily.
I think I've been enlightened on the Affordable Care Act.
Yeah.
I think that's what your
Yes.
motive,
Yep.
well,
That was why we were here,
Right.
so.
This question doesn't pertain to most people because they're not at my age. But,
Nobody's in it.
the government, I read something where the government's gonna start messing with the Medicare Advantage plans. You familiar with any of the changes or what's gonna happen?
I am not.
I just thought to ask.
Medicare is kind of an animal of its own,
Yeah,
and we understand and know it, but we're not experts in Medicare by any means.
That's the reason I saved this question till last, because,
Oh, Ben and I are gonna be interested.
well,
in
yeah,
that
right.
Here in another year.
Yeah, right.
Less that, actually.
I'm gonna
So-
jump off the Affordable Care a little bit if we're done with that. I got a couple other things.
Me too.
I'm curious, okay? Where do you think we're at in our general process of our county as far as, since we've had you guys on board and getting our processes of the health, general property, casualty, bids, et cetera? Are you not finding what you're looking for? You're finding what you're looking for as we get ready? Because we're trying to, one of our goals, I think, in getting you guys on board was to try to make us look good.
Yeah.
Go out for bids and
Well,
things like that, our risk management issues.
yeah, the commercial side, I know there was a question about, you know, bidding and how often you bid, and I think somebody had sent me the legal opinion. You know, what we do, and actually did in your bid specs, that we do for a lot of our public entities, is we set the contract for a 3-year period with the county having the option to opt out at the end of every year. Now, the reason that we do that is that the insurance is not a commodity, and the public bid laws don't understand that yet. So, you know, when you do bid every year, there's an enormous amount of time that goes in on the underwriter side, and you start to decrease the amount of bids that you actually receive if you're doing that annually. Now, we do that annually, and as I tell each of the clients, you know, we'll do it. You know, if you say we're gonna do it, we'll do it, no issues. But a lot of the carriers wanna know that they've got, you know, a 3-year option that they can spread their risk out.
We've only got the same 2 bids that we got prior to that.
Yeah,
What's
part
the
of
reason
that
why
was
it's
timing.
quick?
Yeah, part of that was timing. But the other thing, you know, that we realized, and we've kind of talked with Augie and Billy Ann about this a little bit, you know, the more that we can centralize the questions, and I'll just give the one Alan asked us here very recently was the animal shelter. You know, Alan called, said, hey, here's our question on liability. We've got the answer for him. You know, there was a policy that was purchased. We weren't even aware of the policy. We found out about it. And, you know, Diamond Brothers had gotten a call from one of the department heads. And I think in particular's nursing area or the medical side.
Janet.
You know, they got a policy and we weren't even aware it was there. You know, so the more that we can centralize that and have a point of contact, the better operationally it becomes for the county. From that standpoint, it's a lot easier to manage, you know, who's going where and who's doing what and those kind of things. On the health insurance side, you know, we came on a little bit late last year in regards to the health insurance. You were in the process there. That's certainly something that we can help you look at this year. You know, ideally,
Need to be started on that.
with an October renewal date, you know, and all of the timelines, you know, we probably need to be getting going on that in April, you know, as an example, just to get everything done for that. And then obviously we'll work with Billy Ann on some of the Affordable Care Act stuff. But if you're looking to bid the health insurance, you know, we would need to start looking at that in the April time frame. You know, we'd get the public notice put out, you know, and looking at that. And I'm trying to think. I think an agent had inquired about that. Somebody forwarded me some information that an agent was interested in looking on the health, or maybe that was the PNC.
That was, I think, because that's what you'd ask about.
Yeah, that was CERN.
So
That's
That's what I was
PNC.
gonna ask you
Yeah, that's
about.
right.
They wanna come and make a presentation of what they got to offer. And they also told me that they dealt with you guys
Yeah.
before. And
Yeah.
what are the pros and cons, or?
Well, how familiar are you with trust and cooperatives?
I'm not, I mean,
Okay.
from this standpoint.
Okay.
I need you to go over this.
I know.
We
Well,
need-
real quickly, I'll summarize. Trust and cooperatives are not governed by the same rules that all the other insurance carriers have to play by in the state. So they can kind of set their own rules. They do that through bylaws. We have clients that are with CIRMA, no issues with them. But it is a comfort level for where you're at as a county. One of the things with CIRMA that they do require is a 3-year commitment with no rate guarantees in the second or the third year. You know, so if rates went up dramatically, you wouldn't be able to get out. Now, what we've seen with the other counties is they have been competitive, but they, you know, there really is not per se a carrier. You know, it's a program that in some of those programs you may share limits, you may share coverages. You know, so as an example, earthquake, you know, the program purchases a $500 million earthquake policy. If everything happened to, I think there's 14 counties in CIRMA, if everything happened in one of those counties and they exceeded $500 million, then $500 million is your cap. Right. You're not going to go above that. The one thing with those kind of programs is it's not a pick and choose. You know, the deductibles are set. You know, here's the deductible. There's no asking for a lower deductible. But yes, Effingham County has been with them for about 3 years, and we've got some others that have been with them a little while. We're very familiar with them. You know, as I said, don't have anything you know, negative to say as far as the program goes. It's just, what are you comfortable with as a board? And I've got some boards that have said, you know, we don't like, you know, the restrictions, and we like traditional insurance, and you know, it's a board decision. So,
Does anybody else have any questions? Because we're gonna have to move on.
I just have a real quick comment. Are you going to prepare us an addendum or something for our policy book that shows that we're changing hours for new employees coming on board and our employees?
yeah.
Did I understand that right?
Yeah, we'll work through that.
Okay.
Any other questions?
Thank you, Dennis.
Yeah.
Okay, I'm gonna comment on the Edgar County Airport grants. Last Thursday, I called our engineer, Joe Worley, and basically said, look, I know there's a lot of things going on, you probably heard a lot. We understand there may be some clarification needs to be made, some some corrections to be made, and we want to make sure that we're square with everybody, that we have represented ourselves like we should for our grant applications. And to that end, I asked him if he wouldn't get with the state chief of engineering for navigation or aviation systems and program, which is Alan Malachnik. And luckily, he was able to get a hold of him later on that day or first thing in the morning, called me Friday morning, and let me know that we had a letter coming through email, and you all have a copy of that. And I think it pretty well speaks for itself. I gave Gary a copy also. I did not give anybody else a copy or discuss this with anybody except Ben until today. I guess I inadvertently sent Alan one, but not the one on, I didn't send one to Dale. At any rate, basically the information that we've got is that we are, even though things, there may be a few irregularities or inaccuracies, I've never believed it rose to a level of fraud, nor would revised submittals substantially change the outcome of the program. Regardless of the application information provided by the county and Hanson, installation is both eligible and permitted. In fact, the circumstances permit such revenue producing developments as encouraged in an effort to comply with federal grant assurances. So basically what it's saying is we appreciate your offer to clarify, but it's not necessary. We meet the standards, they're aware, we've had many discussions, and so they're going to plow on. So we have done the right thing by pointing out that there might be some clarifications necessary, or maybe there might be some things that need to be corrected over time that change, but they don't see that as an issue. They don't want
They don't see any outright fraud.
Nope, and they don't want any more submittals. We're good to go.
Jeff, thanks for doing the due diligence.
Well, and that's what it is.
We've asked them now.
When are we gonna owe the money, Jeff?
We will not owe any money until after the first of the year, which will be 15.
Okay.
Okay? The bid process will take place later on this year. The project will not start in the field till next year. And at the time everything's bid let, everything's done, then we will start to owe the engineers money.
How long are we good for that? Do we have to I mean, I hate to use the word reapply, but do we have to, you know, we made that agreement about the money a while back.
Right.
How, do we have to extend that?
No, that is an open, we'll go in whenever, the board gave us permission to go in after, they'll have to final approve it.
Okay.
But we do not have to go back to the board unless you would like us to go ahead and put together the letters and the intent to get the funds.
Okay.
As far as the project, we've got to move along, the engineers will keep us on course as far as that's concerned, but we need to get the project done in 15, okay?
You have any committee reports?
And before you leave, the letters that Hanson asked us to put out in that big thick document on letterhead.
Yes.
That's all taken care of.
Thank you. I thought I would call Rob upon leaving here and let him know that the letter is available in your office, okay, that I just handed you. I think that's only fair to call him because he'd asked, he and I talked about this after that supposed meeting we were going to have that never happened, so I will call and let him know. You can give the letter to anybody, obviously, there's, okay?
Yeah.
I just wanted to make that clear, and that's all I've got.
Have a safe trip.
Yes, thank you, I'm sorry I had to scoot.
Okay, we'll revert back to public comment.
Gary?
Hi, guys.
Make it, okay.
Jerry. Put yourself. There's
217-822.
I don't think you really need me here to say any more.
822-3956.
No, that's
And you
fine.
can reach me
I
anytime.
don't give
Thank you, Ed.
Thanks, Ed.
You got the page.
Yeah.
I didn't bring it up.
You didn't bring it?
No, I didn't bring it. I got that. I gave you that. It has 6 stars on it. So 6 ones.
Yeah, it says 5 pointer.
Yeah, buy that, bought that one at Walmart, didn't
See
you?
ya.
Committee reports. Alan?
You guys heard my insurance spiel, basically. Not that you wanted to hear that.
We don't wanna hear it again.
Yeah, not that you wanted to hear that, but the only other thing, I'll let Dan, you may have something on the animal shelter, so I'll see.
Well, we got
there.
something in executive session that we need to discuss about the animal shelter, so.
Okay, but I think that's all I had, because I was trying to think if there's anything that, if we still do have questions for Travis, that's one of the things he also told me was, if nothing else, funnel it to me, or if you want to funnel it directly to him, that's right, but when I get information like that, I try to send it out to everybody, whether or not you want to read it or not, I don't care, but that way you'll always have it, because I think we're just going to have more and more questions as this goes on, at least for the next couple of years. So I'll leave it at that.
Mike?
There's an advertisement for ESDA manager, and ESDA, I don't know how it's worded, two positions at ESDA, let's put it that way, in the paper. I think we'll get some response from that, and then we'll have another committee meeting and then go from there.
Okay.
Don't quote me.
Call him Aaron.
Because there's nothing set in concrete, but I think NAL is in the process of getting their own permits, so they can have the local restaurants, vendors, whatever, bring sandwiches out there, and it won't be the burden on the restaurant or the vendor, but that's just kind of preliminary. I sent you guys all information on the ambulance. I didn't know if,
Yeah, that was real helpful.
So, I have one question, I didn't quite understand. The only service that satisfies the requirement of 5 years is the one we have right now? Because when you look at the contract, it's already got Shaughnessy's names on it. Or is that,
well, what I sent was the bids,
okay,
the bid request, so anyone qualifies as long as they
well, I was talking about the 5 year.
Yeah, I don't agree that that should be in there.
I
It
just
hasn't
wanted
been in
to,
there ever before.
I think it's gonna be a problem, that's
Yeah.
my point.
Where's that at?
First page,
Very
that first
start.
paragraph.
Yeah, how long the term of the contract is that?
No.
No?
You have to, I don't have it here.
Yeah, I saw it.
Okay, you have to be in business
For 5 years. is
for
what it
5
says.
years before you can bid.
So that lets out any,
You also have to be from Illinois.
all right. So,
I don't know, you let
Well, if
state's
you're
attorney.
licensed in Illinois, doesn't mean you have to be in Illinois.
that says for 5 years, that's the reason why I was asking.
The state's attorney,
Well,
thought
that's
this is
just-
all right. This seems
I-
to me like it,
I have to
all you need
rerun the
one
life.
more statement on here. The only person that can bid is Shaughnessy.
Yeah.
That's my point, that's the reason why I was
Yeah.
asking.
Well, but the other side
No,
of
I
that
think other
is,
people will do that, but we can change that 5 years.
Yeah.
But it's mainly in there just to make sure we've got someone who's coming in here with experience.
yeah,
That's
I think, yeah,
That, we need to know they have experience,
Right.
and we need to know that they're financially able to perform.
Right.
And of course, I think we need, and we suggest we need some kind of a performance bond if they don't perform. Is that something takes over, insurance? And I'd also like in here that I would like, or maybe the rest of them don't, that they get paid quarterly, not upfront 100%.
Yeah, because they may just fold.
Well, that's the other problem we have now. You're basically paying this year with last year's
Sure.
tax levy.
And we've always done that.
Well, when are we gonna reduce that tax levy? Is that something on the books?
If you read your original agreement, you can't, you have to change that.
No, it's always been 20 cents. The only reason that I can see it's ever been raised is because the valuations
Yeah.
have gone up. But
Which,
that's a whole nother deal.
and,
But we
Well,
have a s-
what, you missed my point. Is there some way we can legally get out of the ambulance business and let,
no,
we have to provide by
no,
law?
we have to, not we provide, the different townships that have,
7 county, or 7
Yeah,
townships.
this is
that have
the
said that they wanted this, voted to have this.
You
Okay.
have to,
And I suppose if they voted not to have it, they would, yeah, there's a way that you can. they could go-
You see what I'm trying to say is why are we involved in this? Why do we have to provide this? Why can't we why does the taxpayers have to subsidize it? Why can't it just come out, every time you turn around, they're charging you for something that.
Well, but all town, I think, don't, they
No.
all, ambulance service, I mean, like Kansas, they have their own,
Right.
Northern Ed County has their own, everybody, and it comes out of general funds, I know.
But
They ask
why?
the townships how much,
Right.
but they're still coming out of the general fund.
Back in the old days, all we had was an old, was a,
No, the state changed what was required.
Hospital used to do it.
that's what I'm wondering though, I'm wondering if we if
Yeah,
there's a
maybe
mandate.
the
Yeah, I don't know, Mike, I don't know.
funeral
the answer
homes
to that
gave you a
question.
ride to the hospital.
Yeah, well, that's what they took
Yes.
Roger Busby in the first time, was in a hearse from the
Yeah.
funeral home. You know, and it had a flat tire and broke down out here, and that's when people got serious about maybe putting a little money into the ambulance, and they came to the county and, I mean, that's, but my point is, guys, what, are we just doing this because we're nice, or are we doing it because we have to by law, that we have to subsidize
I
it?
I think you'd have to.
I don't know if you do, I think that if this ambulance service went under, the way we was told in the past, our obligation is because we assessed for it, because they,
You have to levy.
yes, because we have a levy, and then, so we're obligated, but if there wasn't a levy, then we wouldn't, the county wouldn't have an obligation.
Well, my point of view is why, if we're not involved in it, then why couldn't there be 10 ambulance services and you just dial 911 and one of them gets like the wreckers? We're not obligated to provide a wrecker for cars. They call the sheriff's department and say we need a wrecker, and the sheriff's department sends them out one.
We are obligated for this levy now. and
That's
we're
what I'm
obligated
wondering
to
how we
provide
can get out
some.
of it though.
Well, I would guess.
probably
that
by
them-
referendum.
Hmm?
Probably by referendum.
Yes, if them,
Yeah, I'm sure you'd have to have a referendum.
Those
In all 7
7
townships.
townships.
them 7 townships decided that
That
they
was
didn't.
before, yeah, those 7 townships, this
Because
was.
technically, like, the county's not paying for this. Those
Well,
7 townships are.
We're administrating it, and
Yeah, but-
I don't know why
right,
we have to
right, wrong,
administer it.
Right,
I mean, that's, well, we're gonna have probably administration
we
of
were
different things.
operating at
Right.
one time.
How'd the hospital do it when they ran it? I mean, did they
They
use
got-
tax money for that? or-
They got paid same as these
Okay,
people
I just
from,
wondered.
they got the amount of money that is here. Originally, the county had that obligation for that area. The hospital said that they would do it. Then they found out that
Hospital
they didn't want to, it wasn't profitable or whatever it was.
They
And then-
couldn't do it for the money they were getting.
Right.
Right. And
That's
then,
when
Now
I
they
first,
probably
when I
could.
first got involved on the ambulance.
then the county got it, ran it themselves, and it wasn't. The county has more obligations than an individual. The county had to supply the retirement, the county had to supply health insurance, because they were
Yeah,
county
I-
employees
yeah,
then. And so the thing was,
You-
not making any
You
money.
remember back, and tell me if I'm wrong here, because you were there, but, remember back when this all started going to D, was Herman was down there, I want it, you know, the Paris Fire District was thinking about taking it over and making it and that didn't materialize for some reason.
And I wasn't involved then.
Yeah.
I knew not- Oh, I got on the board
That never got to me.
right about the time D. took
I got you, but that's originally what it was, because I was on the merit commission when it happened, they were talking about how they were gonna roll that over, and he wanted it, and he said, man, I'll take the money and build extra buildings, and we'll maintain it, you know,
When he said, he meant the fire
he
department.
meant the fire
Yeah.
department, and it would be the same 7
Yes.
as in the fire district. That never happened. Well, my point is, guys, what I'm saying is, if we can, why do we wanna be involved in this if we don't have to be? If you see what I'm saying, why can't we why are we burdening the taxpayers with a levy?
We aren't, they did.
Those townships.
Well, that's what, but,
Then I think you need to go back
Then
to
what are
your
we talking
township.
about for
Then I
then?
think you need to go back.
No,
to-
we-
because we have an agreement.
No.
evidently.
I guess,
If you're having a heart attack, you want somebody to pick you up.
I'm not saying that, but I'm saying
Somebody gotta do it, right?
why aren't the people paying for it that use it? Why are the tax?
You know how much Medicare probably pay for an ambulance service?
Well, then maybe they wouldn't go pick up these people that have a sore throat out.
Well, I understand that.
That's what I'm
but
getting at.
Also got people broken
You're
legs. and
Our
heart
obligation, I would think, is to make it as less costly as possible to get the service.
Right.
And that's what you're attempting to do here.
Well, I hate to
You
say it's
have
for
been-
the public good, but it is.
Right,
If
I
we did
agree.
not have this service, and again,
A lot of people
I
die.
cannot brag enough on the
The
service we
maximum.
have now. And if they're not here and you just open this up, okay, let somebody in Terre Haute have it, do you wanna wait till that ambulance to
Oh,
get it?
no, I'm not advocating that. I'm
Oh, I know,
advocating,
but I'm just saying that,
how are we, why is the county board of 7 people?
well, that
We're
was just
working
an
together
issue.
It's
with
just
the
the
township.
obligation you get.
I think we're working together with the township.
Okay.
I mean, that's how I
Yeah,
look at it.
before.
We're looking together with the townships,
That
kinda
was
like
the
we work
original
with the
agreement.
township
I look
road
at it,
commissioners,
right.
kinda like we work with the city on certain
We're
projects.
working with those 7
I look at it as
townships.
a service
Because
that
I
they
think
probably
if the
have.
township, if those 7 townships truly wanted to, they could at least, I definitely would think by referendum, but maybe there's another way they could do it, say, we want to dissolve this, boom. And I bet they could do it. But I also bet there's probably some state law that comes back and says,
Yeah.
guess what?
Yeah.
You guys in the county, you get to do this.
I look at it as a service.
And then I wonder, Mike, and I understand what you're saying, let the users pay for it. Is that what you're saying?
Well, that, and let the users pay for the administration. This is,
But
guys, what I'm trying to do is lessen our footprint. In why are we the guys left holding the bag? Sure, these people out here in the townships want this service. Let Ben and Mike and Alan and everybody else decide how they're gonna do it. Let blame them when the damn thing quits. And I'm thinking if it's just one less thing we have to worry about as a board. Now maybe we're obligated, if that's the
We
case.
aren't.
We're not worried about it.
We're obligated to
Yes. As long as that
operate
agreement's
this the
in
way it
place.
is at this point in time.
Okay.
it's probably gonna, is being
And-
operated as cheap as it would be otherwise.
Well, my answer to the question is, and what I'm thinking is, why isn't this on like 911 or healthcare or the health board? Why is it a county board? Why don't we have a committee that runs this and makes these decisions?
We have a committee to present us with something to bid on.
After that, then you have you have Shaughnessy, that's a private entity that runs them.
Right.
We're done with it then.
And we have spelled out what we
Right,
expect from
right.
them.
And after that, we're done.
Right. Only thing we have is if they don't meet
Right,
what they've
right.
agreed to, whoever has it, right?
But in these 3 pages, he's basically put down what he is doing now.
Right.
And yes.
Which I've
it's
got
a-
no argument with at all.
No, and it's a high bar, but I've been told we have to put this out for bid, so, okay, we have put out for bid, this is just a suggestion, if you guys wanna change it.
I
I need to
just
know
think
pretty
that-
quick, and I have not talked to the state's attorney, but he got
Oh.
a copy of this too.
I think in 5 years we cause a problem, that's just my opinion.
Well, instead of 5, what do you want?
Yeah, I don't know, I don't have
You
a
don't
problem,
want
I don't know
one
if the
year,
5 years or something, but I don't really have a problem with multiple years.
No, I don't either.
That somebody's been, I don't know whether it's 3 the magic year or 4 or.
That's why I'm asking,
what it
if
is.
you
I don't
don't
know,
want
Dale,
5.
but I'd like to, I wouldn't bother me. to
I
I
have
would
something
have, I
that
would
said-
have to tell you that for your information, that Dee Bergen was not in for any years when he was,
Yeah.
that Shaughnessy was not in for any years, and
Say
you
3.
guys are agreeing that they were successful at it, so you're saying now we need to put bar higher.
It
Because
doesn't
why?
bother me.
Hmm?
It
Well,
doesn't bother me.
I just
What
think
do
it's
you
gonna be a
want?
legal problem.
He's saying it doesn't have to be based
I'm
on
saying
what's
if
in the
they're,
past.
if they're qualified, if they're paramedics,
They'll fill all the rest of those
Right.
books.
paramedics and have all the other things here, and they can show that they're
A good-
financially
Right.
able to operate it, which will make, you'll make a number or something that they have to, then why are you putting, because the 2 that you've had didn't have any.
I understand what you're saying, I'm just saying, man, it wouldn't bother me to
Oh, me
have
either.
2 years or 3 years, or some other year
I'm just
of
saying,
like, some sort of credit
Right.
behind it, and I definitely agree with you on the part though, that I think we need to have some sort of a bank line or bank line of credit, you know, that it's gonna be referenced that, you know, because they're gonna be getting some money from us.
Yeah. Now,
I mean, I'd like, to if we're any,
There you
that's
go.
just the same way like we're talking about even with like airport and stuff, I mean, however that ever happens and goes out, we're in a ring in my mind with business agreements with people, and I think
Yeah.
we need to have, I think we have every right to know what's behind them, and you may
Right.
be right. I mean, even if we don't have any years behind it, I think we need to have the other part.
Yeah.
You know, the references and the bank statements that says, yeah, we'll make sure they go for a year, or whatever we think they.
I was thinking the legality of putting 5 years, because that limits only one.
Well, but it's not necessarily a company, because you could have, just like you're saying, you could have paramedics that have been licensed and running and everything else. I guess they could form their own company if they were out of Casey,
Right.
come up here and say, yeah, we'll put that right in here, and guess what?
And we're
We've
gonna
all
buy a
been-
building?
Yeah, we've all worked this thing for 10 years, so we're all qualified. So I don't know.
That's
the
the other
answer.
thing, one other thing that's in here, it says you have to buy a building. Well, why couldn't you lease a building? You have to have it, it's obvious it needs to be in the
Well, the
center
only
of
reason,
the
you know
area.
what, the only, I saw that and I was thinking, you pretty well sum up the fact that they can't say, well, we can't operate here anymore because we lost our lease. You know what I'm saying? They're obligated to be, I don't know how you'd word it, but they're obligated to be centralized.
And that's why I like.
And maintain it.
Quarterly,
Okay.
so that's
That's
why I
what
like.
bothers me about a lease though, too.
Right, you need to have some sense of urgency that they'll be here.
You know, if the contract's 6 years, they need to have a 6-year lease, don't they?
Yeah, or something
that-
that keeps them here.
Right.
But they can't just lease it rent it for 2 months and up and say, well, we decided not to rent it, now we're basing it out of Alany.
Well, no, they can't do that. It's right in here that you have to have, and you couldn't operate it. It has to be operated out of here for them being able to get there in a timely manner.
Right.
It has to be based.
I
on
guess they can
business.
hang out at
That's why you
Casey's
gotta
and hang
have
out
it.
at.
Yeah.
Well, but
That's what I'm
it
saying,
just
otherwise
says
somebody will say, well.
in the area, right?
We'll come from Terre Haute.
Yeah, but it just says in one of those areas. It doesn't say actually Paris, does it? I thought it just said
Well, I'm
in
not
the
sure.
area. I think, well, I mean, your odds are you're gonna be in Paris of those 7 townships, but I thought I read, and I could be wrong on that it said within that
Well, it
special
needs-
ambulance
it-
area.
Well, whatever it says, it needs to say centrally located.
But this is one of the problems we've had, I mean, in Barris and Kansas townships decided to opt out of either one of these. They didn't want Northern, they didn't want this. Why? Well, they thought they could do it cheaper. And let me tell you, there's been a couple of cases, in my family even, where that didn't work out real good.
Yeah.
My mother-in-law needed a trip to the hospital, don't put that in favor. The ambulance people that were covering Kansas Township, the ambulance was in Oakland. These people were in Brockton. When they got the call, they drove from Brockton to Oakland to get the ambulance, come back, pick up my mother-in-law. A lot of time
I
passed.
just, right.
Now things turned out all right, but boy, let me tell you, if they hadn't,
Right.
there'd been some changes made. But,
And
So
that's.
Dale, what do you think? I mean, you're not concerned about the 5-year thing, or you're
Well,
okay with all of it?
No,
I mean, 'cause
I'm not
you've
saying.
worked at it more than anybody else has.
I don't know that it needs to be in there. The only reason he put it in there was to make sure we get people who have the experience. But Ben makes a good point. Yes, did we have experience before? No. D came from the fire department.
Right.
He was a paramedic, one of 2 paramedics on the fire department.
Right.
And believe you me, I've learned a lot about ambulances, but if the fire department was the first responders to a scene, and Dee Berger and the other paramedic are wearing their fire hats, they could not perform paramedic.
Right.
That's in the law. There's my asinine quote. Don't put that in there. When I heard that, I said, you've got to be kidding me. Now, they
No,
told
you're
me,
saying they couldn't take their hat off and their coat off and go
No,
over there and
because
just-
they were there at a lower level,
they were there as firemen,
either
put out the
EMTs
fire,
or
secure the
first responder.
scene. Now, they both told me, off the record, do you think we wouldn't help?
Right.
If you needed CPR or something
Or
else,
they get there, the fire, and some guy's out in
Yeah.
the front yard beating the living crap out of his wife. They jerk
Yeah.
him off there and
yeah.
sit on him till the cops got there.
One
They better
reason,
do that.
that's one reason the Good Samaritan law was passed, so any of us can operate on each
Right.
other here with
Right.
CPR.
Don't quote me on
You know, if I break your rib or something,
Right.
I've been trying, you can't really sue me because I'm the good Samaritan trying to.
Right.
It's on record, it's going.
It's on the camera.
Shut that thing off.
Destroy it.
I don't care. You get, but I see what that 5-year thing, I see through that, what that means, and I don't think that should be in there.
And so this means,
If it's preventing someone who's otherwise qualified, as Alex says.
That was my point.
It's
No,
kinda
I don't
like-
want that 5-year to preclude them from making a bid. No,
Okay.
I don't want that either.
And
And
an
again,
answer-
I haven't talked to the state's attorney to see what he thinks of this.
in answer to your thing where they opted out, like Chrisman did,
Yeah,
Chrisman doesn't have as good a response time, generally because people aren't there, like they are here.
no, and I
That's
wasn't
what they-
going to say that, but I'm glad you.
Well, that's what they've
That's
chosen,
true. Yeah, they've chosen that.
and
that's-
Kansas too. I mean, I don't know what they've got, but if they don't have anybody on duty,
Yeah. And they've called Paris to help out many times, and that's in here too. You will help assist all the others in here,
Yes.
because we don't want you saying you can't, but they've all pretty much got the means of laid down to where everybody helps everybody else. Now, that hasn't always worked perfectly either, but,
service is apparently satisfactory most of the times for these outer
I
areas.
see a lot of excellent.
Which,
Yeah.
Well, you've seen it worse, haven't you, Dan,
Oh, yeah.
over the years?
I've seen one bad thing, that was with the rescue one out of Christian. Other than that, they all work pretty well.
But I mean 10 years ago.
10 years ago, it had some problems. When the hospital went, they had some problems too.
Yeah.
yeah,
But
yeah, everything's kind of,
but right now, it's excellent.
they had problems following the 911 system, trying to locate people.
Yeah.
mhm.
Yeah, I remember that. And then the lot, there weren't signs out, you know, that was.
No, some people
Well,
put
when they went
signs
to
out.
put the county signs up, works much better. How many years that's been effective?
Well, with GPS, it works really
Yeah,
good.
right.
So, my suggestions, I haven't heard anybody that, what, you know, the quarterly pay, and if everybody else don't think that's an issue.
First I'd heard of that, but that don't sound bad to me.
Well, actually, that's how the original contract was, but then shortly after,
Well, Donnie would probably go for that too, wouldn't he?
Well, when you say quarterly pay, what do you mean exactly? Is
they
it
get paid
annual?
1/4, and we get the money, but we don't give them, but a fourth of it is, fourth of it, when we get the money in, fourth of it,
But
3
right
months
now,
later.
you're essentially a year behind right now.
So they've got to have the money to last year before they start getting
Right.
taxed.
I mean, if we did nothing and the contract expired May 31st,
That's how, what you're saying, but
no.
D did
but
not
I'll just
go,
look-
D did not go a year without being paid.
I know,
You got
but
paid
listen
up
to me
front.
for a minute. What I'm saying is, if for some reason this contract's not renewed, end of May, you're still paying Shaughnessy last year's levy for services done in 2013. That's the bad news.
No, now,
Yeah.
then he got paid for a year of D's. Because he
But
got
you're
paid
still
when
a
he
year
first
behind.
started.
You're still a year behind, that's what I'm saying. If you have no agreement May 31st, you've got $100,000 in one account that's gonna help you get started for the rest of this year. That's the way it's written. And,
That's not the way it's been implemented.
well,
They've been paid in advance, not in arrears.
all right, if you can prove that to me, I will totally agree with you on the paid quarterly part.
Well, I can prove to you that D got paid as soon as he started.
The other thing, and whoever bids this, and I'm just thinking out loud here, whoever bids this is going to know what the levy is.
Yeah.
So they've got a starting point.
Right.
But the statute also says, if someone comes in here and says they can run it for cheaper, that difference, say they can run it for 50,000 less than the levy.
Yeah.
The statute says that money goes back to the individual taxpayers.
Mhm.
Now, who's gonna implement that? Treasurer gonna write an individual check to every taxpayer in this county? I don't think so. But the
Oh,
statute
I
does not say it goes back in the general revenue
If
fund.
it never goes back into general revenue fund, it would be in the ambulance fund, and next year, this, I would anticipate it being
Well, I'm
able to be
just
done. It could be, the levy could be lowered to that, because it's
Yeah.
a 6-year bid, isn't it? So the next year, you could lower the levy to where that money wouldn't, that money would not have to be.
I'm thinking we should be doing that anyway on a scale where it goes to zero.
Well,
That way,
well, actually, the agreement says, no, the agreement says you will,
We can't raise and lower that levy.
what do you mean
The
we can't?
county board can't just raise and lower that levy.
Why not?
Because, just can't do it. You'd have to have a referendum to change the levy.
That's what I mean, yeah.
Well, referendum, not the county board. I'm saying all the taxpayers would have to.
You mean
vote.
they'd have to vote on it?
Yeah,
We can't do
sure.
it.
Yeah, I'm not an attorney here, but yes.
well, we could sure find out about that.
Yeah, but
Because, and what you're saying is, it don't matter what anybody bids, we have to pay them.
Yeah, the money that's there, and what I'm trying to do is get out of the ambulance business.
What are you gonna do if you get out? What- I
We-
mean, how long's it gonna
Yeah,
take?
and you can print that. I wanna get out of the ambulance, we got out of the
How long is
building.
it gonna take to form another ambulance service? And people gonna die of heart attacks and
What?
broken legs? I mean,
I don't wanna lower the.
You could answer
I don't
better,
wanna
maybe. I
lower
don't
the
even
service.
know that.
I'm
I-
tired of. the
I would
taxpayers
assume that
paying
they
for it.
need a good percentage of this money.
You don't think they're gonna have to pay for
When
it?
you on the board there,
they have
you might
17
have to-
You don't think
people
they're
working
gonna pay
on
for it anyway?
No,
Who is gonna pay for
Charles
it?
has got
the
19.
people that
Yeah.
require the service.
That's 24/7.
But they're
He's
never-
got
those
four-
people aren't gonna be able to do
Four, that's why he
that.
put the four in.
That's what he's saying.
And we discussed this last Friday for an hour and a
Medicare will
half,
ever pay
and
for
in the
those
first
people.
30 minutes I
So
was
they're
there,
gonna have to.
3
pick
calls
them
were
up.
I'm like, I shouldn't have
I
come
don't
in.
know
He
that.
couldn't
I'm
believe
just-
I'm
So the
just,
fourth
that's
one's
where
there
we
ready
need to start
to go.
putting our foot down.
somewhere
Well,
else.
it's
Federal
good
government
money.
money.
It's
So
that
we
way
need-
2 or 3 times a month. or-
And say, then don't call them for
Yeah.
But
it.
they have-
Well, it won't be that, it'll be
But
when
when the
people
hospital
die.
got out, we essentially went to Champaign and
And
approached
nobody
Provena.
goes to pick them up because they don't have a card that says they're gonna pay for it.
One of them took it over.
Carl,
You think there's anybody out here not gonna vote for that?
Somebody else.
I'm telling you what, I got an $1,800 ambulance bill,
But
come to
Provena
my
agreed
house,
to
pick
it,
up my,
and then the same thing happened to
$1,800.
them, they said they couldn't
$23 for a piece of gauze.
the amount.
It's nutty. And they told me, says, well, it's because the people can't pay, you're picking up the additional cost. My insurance company said, we're picking up $1,000 of that, you're writing a bill for the rest of it. I said, Rich Cash called me and said, let's go to court, and I said, set the date. That was 6 years ago, I've never heard
The
from him
opinion
since.
of our state's attorney is that we have to,
He basically told me we have to put out on bids or
Yeah.
we would be subject to a lawsuit.
yeah,
But I
so,
can't find any statute that says that you have to put it out on bids. And off the record, the treasurer told me the same thing. There's different things the county bids on, and he
Mhm.
says this doesn't fit into it. But he is not our legal advice.
That's right.
And I'm not putting words in his mouth, I'm just saying that's what I was told. But, I mean, the treasurer's entitled to his opinion, but the state's attorney's the
and,
one
and
that
none of
answers.
these things are off the record because
Well,
this goes right on the internet.
Mhm. Oh, yeah.
all right.
As a matter of, right, this goes on,
If we choose to upload it to the internet, yes.
okay.
Can they FOIA it?
Sure they can.
I thought,
It'll be preserved.
oh, yeah.
I'm not trying to get the cart ahead of the horse, but I'm saying if we get this to where we get 3 bids and they all know what the levy is and they all bid that amount, we've got a decision.
Mhm.
Now, the state's attorney also says we do not have to accept the low bid.
Right,
Right.
If we do not think it will be the quality of service we have now.
right.
And that's what I'm going to be stressing, my one vote is,
Mine too.
don't lose what we
Right.
have, because we have a super
Yes, we do.
service compared to what I see close by, and you just mentioned it. I've got nothing against Northern,
No, that just makes
but
sense.
they're
If there's not
volunteers.
somebody
I mean,
there,
the phone rings and you've got people showing up that are not paramedics. They do the best job they can.
some are. though.
Some are,
Some
and
are.
some aren't.
I'm saying
But
they're
that-
not,
but they
they're
opted
gonna be
for that.
15 minutes later
Right.
because they have to get there.
Yeah, and as I said, the same thing in Kansas and
Yeah.
Paris, so I
Or
think
5
it's a
minutes,
great.
whatever, they ought to be, they're gonna be later. Because there should be people at this place ready to go as soon as the phone comes.
24/7.
Yes.
Maybe we need to concentrate on getting the absolute best bang for the buck. And that's what our obligation to the taxpayers is right now, is get them the quality that they deserve and get it for the least amount of money.
Well, when the hospital got out of the service, the proposal was made to me for the county that owned the ambulances to sell the ambulances. That was my first response. What are you gonna do Monday morning?
Yeah, right.
Alan Zuber needs a ride to the hospital. Gee, can't call anyone in Paris or Edgar County. I guess we'll call Terre Haute. Do you not think he might sue the county for it? So that was my comeback. So that idea was dropped very quick.
But we don't know that, we aren't sure that the county has any obligation to have ambulance service. Correct?
Well, that's what he's saying.
Oh, no, I'm saying other than the referendum that was passed, that these townships want to have an ambulance service.
Yes,
Right,
the original
and that's that's where the obligation
I've
comes
got that
in.
buried in my archive somewhere. It goes back to '87, I believe,
Yeah.
when it started. When I first-
And that's where the obligation comes in, right?
That's the
Levy.
obligation, but we entered into the obligation, and we have the obligation
Yes.
until something changes. And if you wanna change it,
I'm
I'm
just
not gonna
wondering
argue
if that
with
wouldn't be some place to explore.
well,
I would,
I don't wanna tax people
we
unfairly.
can't explore it. All we are is implementing what the 6 townships have asked us to do. They're the ones that would be exploring not wanting to do it anymore. 7, yeah, okay.
no.
Right? I mean, we're just collecting a levy and dispersing it.
That's, well, we're doing a little more than that.
And trying to
We're sitting
do it
here
in
wondering
a-
about a contract, and we're
Yes.
administrating the whole ambulance
Right.
service. And I'm just wondering if we are, number one, obligated to do that, number two, if that's the wisest, cheapest way to do it.
Well, number 2 is irrelevant. If we are obligated to, we have to do it, right? If number 1's correct, that we are.
You're right,
Yeah, if we are.
You're both right. But if we
Don't
do
tell
it,
them that, Dave.
It's horrible.
No,
I'm making friends.
he's the chairman here, he's always,
No, but seriously, if we do our due diligence, we should look at other opportunities or alternatives if they're out there. I personally say, I can't imagine that there are, but if you wanna look into it or pursue it,
I just was dumb enough to ask, that's usually my forte, you know?
now you're on the committee to find alternatives. Anybody else have any suggestions? I have not talked to Jeff, who had to leave.
Yeah.
Carl got a copy, I assume. I haven't talked to Carl either. But if you got anything else
You
to,
need to do this by
well, it's not,
June 1st, I guess. Before June 1st, it has to be done.
yeah,
right?
I didn't get a commitment from the state's attorney, but I would like to see this thing out 60 days before May 31st when it expires. And that's
Pretty quick.
into March. We're talking in 30 days, so I guess I would say at this time, within 30 days, I'd like to be able to put
Yeah.
the bids out. to
That's
whoever.
doable, isn't it?
I think so. Yep. But I want everybody's opinion, and then, as I said last time, run it by the state's attorney and see what.
What you're asking, would we have to have a resolution to set out those bids before we actually put them out? I want to check with Mark.
Like
Or-
lay over
or, you
30
know,
days, you
No,
mean?
When's our next?
What I'm saying in March, do we need to have anything on our March board meeting saying?
Yes, I
You
think
beat
we
me
do.
to it.
yeah.
Is that March, am I looking at the calendar, March 12th?
Yeah, probably.
Yes.
I'm just saying, but, I mean, that's still plenty of time to get them out before your, end of your March, but but April is not.
No.
If we have to
No,
have something
I
at a board
thought-
meeting, then April is
Yeah,
not.
March
enough.
12th to be our next board meeting.
I thought that last week, so yeah, if we could
If
come
we
to the
have to.
study session here on Monday and make sure everybody's on the same page, then I think we'd be ready.
Well, you certainly would want, I shouldn't speak for the board, I'm sorry, but
If we can't do it by the 12th, I assume we'd have to have a
Special meeting.
Yeah, that's what I was gonna
just to do that.
we try to run everything, get approval from the state's attorney.
Yes.
So if you,
Do you have anything else?
No.
Did you ever find out about that meeting that they said we didn't go to, but we wasn't invited?
Well, at the PACO meeting, I'm glad you reminded me, Mr. Colvin wondered why there was no county representation at the enterprise zone meeting. Well, first of all, they never told me we're having a meeting. So I later found out the only people they contacted were chairmen, such
Yes.
as chairman of the county board. Ben was duly notified. Due to weather, the meeting was canceled. They had another meeting, but they didn't informed
Notify,
Ben
right.
that they were having. He was not notified on the second meeting. So they really shouldn't be mad that there's no one in attendance because no one knew about me.
So I just gave Paul and Bob both sides and said, hey, if you can't get a hold of somebody, there's 6 other people on that board. Oh, we'll get a hold of them.
Actually, when they got a hold of me the first time, somehow they had my email address, that's where it was on, so they would have been able to get a hold of me that way, unless they decided to have it.
Well, I sent Ben an email that I had sent to Coleman saying, you know, next time, copy me in, copy Ben in on any emails you send me, which I get very few, but.
But that's what I told them too. I said, you know, if nothing else, you're kind of, I felt like kind of our representative on the board for that avenue. You know, like going to pinnacle meetings, and that would be another follow-up there. I do with the Department of Economic Opportunity.
I asked Dale to go to it.
Yeah.
But I didn't even know about the enterprise meeting. Ben's the only one that did, and Ben was planning on attending.
Right.
If I'd known about it, I'd have gone also. I would have liked to have just been there. So,
I do have an
It'll
email
get better.
address at the hospital, so I'll check and see if I can receive emails, my business.
Can we go on and get Augie's thing out of the way, because we need to go to executive session
Okay.
and talk about something.
We gotta give you a chance. So.
Oh, I forgot about Dan.
You got it.
We haven't met with Andrew since last time, so I have really nothing right now.
I'm sorry,
Okay.
Dan, I didn't mean to.
No, he did on purpose.
Yeah.
He did.
yeah, what do you want, man?
Okay, we'll let Augie. Preservation of historical books. You wrote this on down here because I asked you, I guess.
What do you want to talk
Based on
about?
the guy, we want to say,
Oh, on Butch?
yeah.
I wasn't there, so you guys,
What do you think?
Butch is wanting to is preserve a book in the,
He wants to try to get grants,
Right.
and it's nothing cost to the
Okay.
well,
county.
then that's why it's a
He just
no-brainer
wants
to do it.
permission.
Yeah.
That's Bush.
Okay.
That's what I told him. I
Yeah,
said, go
that's
get it, as
good.
long as we don't
Yeah.
have to put any money out, you go get all the grants you can.
I think he just wanted to give a
Yeah.
presentation.
And I appreciate
I
that
do too.
because
There's-
the,
there's-
Does anybody disagree with this?
No.
Then, okay. That's the report you can give him then. Augie, do you have anything else?
no, sir, no.
Full
Okay.
speed ahead, Butch, okay.
Oh, yeah, that's Bush.
Shut the thing off so we can go into executive session.
Well, you have to make a motion.
Oh,
Yeah.
I make a motion, we go into executive session.
For what reason?
We need to talk about,
Appointment, employment, compensation,
All that.
all that,
All that.
per attached.
yeah.
School teacher.
Do we have a second for that?
Second.
All those in favor of the usual sign?
Aye.
Opposed? Same sign.
Lunchtime, Gary.
Yeah, maybe.
Yeah.